This is a guided tour through the hospital. We are in the outpatients department of the hospital. Before us is a monument of Kumi Hospital, which started in 1929, but it has transitioned to a general hospital. So when the outpatients come, this is the section they come to. The weighing, the clinical observations are done in that room and the registration. And then the patient flow moves on to see a clinician, and then to the lab, and then to the X-ray unit, and then the ultrasound scan unit, and then the pharmacy. So this is the emergency room. When the patients leave the clinician's office, this is where they are attended to by our nurses. And also this is their waiting area where they have to wait for their treatment. While they're here, there could be health messages transmitted to them while they're seated here. This section of the hospital is the inpatients department. Right there is the children's ward, and then behind that is the main operating theatre, and then the maternity ward. Many years ago, when this was a leprosy hospital, most of these wards for leprosy patients. But with the improvements we had and support from the Dutch people, we were able to renovate this ward specifically for the care of children. When we receive patients, some of the patients need support. Because of the few nurses that we have to have attendants like that, having to support the patients and having to support the children in the various wards. They can help with the laundry, they can help with the cooking and the cleaning up of the personal effects. Right next to the operating theatre or the operating room is the surgical ward, and then behind is the attendant shed. Before, there was a lot of crowding of attendants preparing their meals on the verandas, but again, with the help of friends of Kumi, we were able to erect that attendant shed. They keep most of their belongings there, their fuel, firewood, and cooking utensils. And that helps minimize the crowding and improves on the cleanliness in the hospital. Yeah, most of the water we get is from the lake. The lake is about 7 kilometers from here. We consume about 180,000 liters of water per day. So that over there is the physiotherapy department. This is where most of the children with disability are screened, assessed in preparation for corrective surgery. The club foot clinic is held here, and also children with cerebral palsy are also managed here and offered physiotherapy interventions. On my left is the nutrition unit. We do have a problem of severe acute malnutrition in our community. When most of the patients are referred from the community by our field workers, and then once their level of malnutrition is assessed, a plan is instituted to rehabilitate them. This is our maternity ward. This is a preferred destination for any mother who is expectant to deliver because of the commitment and the work that we are doing in the hospital. So the ward is divided into the prenatal side, and then the postnatal, normal delivery, and then the postnatal surgical. We deliver about 1,500 mothers here every year, and then also we're able to offer about 500 cesarean sections to mothers who get obstructed labor. We struggle with what we have, but we hope that with other partners we can be able to fight disease and poverty. We try and do as much as possible with the little that we have.